Hello, good afternoon, everyone. Thank you all for attending One Generation's Health and Wellness Webinar Week. Thank you for those who have been participating yesterday and this morning and just being involved in everything here at One Generation. We're so grateful for you guys taking your time with us. My name is Niambi Cooper, and I'm the director of One Generation Senior Enrichment Center, and we're led by our organization's president, CEO, Jenna Haas. So this webinar layout will be composed of having our presentation first by our lovely Stefanie Elkin. And at the end, we will have our Q&A chat section at the end. So feel free throughout the entire presentation to use the chat box, to also use the Q&A at the bottom if you want to ask a question anonymously, or if you just simply don't want to do any of that and you want to verbally ask a question, then you can just click raise my hand or raise your hand at the bottom part of the screen, and you can verbally ask a question to our presenter. So this presentation is being recorded. So that means that we will have access to replaying it over again and placing it into our One Generation newsletter. So, which is great because you can share that with your friends and your family, and you can rewatch it yourself over and over again. So if you have any questions or you just want to, watch it again, we will have that available in our newsletter and also on our website. So I will place our telephone number into the chat box, and you can just give us a call and say, I want to get signed up for your newsletter, and we will have all of our presenters, well, majority of them on there that want it to be recorded so that you can watch them over. So our telephone number is 818-705-2345. So I'm super excited to introduce you to Stefanie Elkin with Be Present Care. So today, Stefanie will be presenting on the topic titled Advanced Care Plan Mythbusters, 5 Truths to Honor Your Wishes. So Stefanie has over 20 years of diverse nonprofit experiences in the elder care field to meet individuals where they are. Stefanie started Be Present Care, which guides and supports caregiving and end-of-life conversations, plans, and programs. From empowering family caregivers and solo agers to facilitating end-of-life option discussions, including medical aid in dying. Stefanie is a compassionate, dedicated, and resourceful connector who is committed to fully addressing her clients' quality of life goals and bridging relationships between individuals, families, and community. So Stefanie is truly, truly amazing. So Stefanie, thank you so much for joining us today. We're so excited to hear your presentation.
Yeah, well, I'm excited to be here with all of you and being part of this wonderful series that One Generation has put together. There's some outstanding speakers throughout the week, and I don't know if some of you were able to attend the symposium on Saturday. So I'm an educator, and so that's why I love partnering with One Generation to providing good services of support. So thank you for that. Niambi did a great job kind of overlaying of myself and why I'm here. I also started my career with Lisa Gibbons Memory Foundation. I ran what was called Lisa's Care Connection, which was a free resource and support center for family caregivers. And there I really, truly got an understanding of the dynamics of taking care of yourself and others as we age. And I feel as we do that through elder care and end of life, it all starts with advanced care planning. And so that was why I really wanted to focus on that topic with you today. Please feel free to have your chat box open. We will be utilizing that. So here's the kind of lay of the land today. Just a welcome and introduction, advanced care plan myths. We're going to be reviewing about 5 of those. There are a lot of myths, but we'll do about 5. And for you, some of you might already have your directives. I hope that this presentation validates what you already know and what you're doing, or kind of makes you rethink and be mindful about what you might want to be adding to your directive. Some resources, friendly reminders, questions, and wrap up. I am going to be sharing resources throughout, use of chat to stay engaged with all of you. Once again, this is a safe and confidential space to share information. Yes, we are recording this, but hopefully with Niambi and myself that we are here to hold this space when we are a lot of people as going through dynamic changes and transitions in our lives, and we're here to honor and be of support for and with you on all that. And I hope you all respect each other's, if people have to share their experiences as well. And this is a judgment-free zone. So this is a little bit of a participation section here that I want to know how you're feeling right now, how you're doing today. So if you could just add that in the chat box for who's here. I'm excited to be here with you, and always grateful to have an opportunity to talk to everybody. So I guess I'm saying 2 words. I'm excited and have much gratitude for all of you being here. Diambi is also excited. Is there anybody else that would like to share in either the chat feature of how you're feeling right now, like today? You're happy to be here. Thanks, Andre. I'm sorry if I pronounced your name wrong. Okay, you're happy to be here. Wonderful. Thank you for taking your time to be here with us. How are some of others feeling today, right now? Looking forward to the meeting. Yes, I guess the idea of always getting becoming educated or just validate what you already know. And like I said, I love to be a resource, so that's great. So I'm glad you're here with positive anticipation. Anybody else would like to share how they're feeling today? Grateful, yeah. All right, wonderful. Well, before we go into today's presentation, what also I like to do is take the opportunity to remind us all to breathe. That's what we all have and really have in common, is this opportunity to be centered and together here together. And we during COVID, we do have busy lives, or we don't. Sometimes we get busy in our heads. Maybe we're not physically busy, but we're busy in our heads and mind, and especially during COVID with the news and everything else going on. So as I want to separate what we did 5 minutes before here, and as we move on to something else, especially for a topic around your own health care, I wanted us to take a pause for me and with you to do kind of some deep breaths. I think when we go into some of these conversations, this fear around talking about healthcare and end of life care, it can bring up some different feelings of fear or nervousness or overwhelmed of like thinking about, if you're not able to speak for yourself. So want to take the opportunity right now to do some deep breaths. So this is called a 4-7-8 breath. And I'm going to lead you in this. And you're going to breathe in for 4, hold for 7, and breathe out for 8. And if you'd like to close your eyes, I mean, we're not seeing you anyways, but I'm going to encourage you, I'm going to welcome you to join me as take a deep breath and take a deep breath out. And then you inhale, 2, 3, 4, hold, 2, 3, 4, 5, 6, 7, and out, 2, 3, 4, 5, 6, 7, 8, and in, 2, 3, 4, hold, 2, 3, 4, 5, 6, 7, and out, 2, 3, 4, 5, 6, 7, 8, and in, 2, 3, 4, hold, 2, 3, 4, 5, 6, 7, and out, 2, 3, 4, 5, 6, 7, 8. I think it's sometimes nice to kind of pause in between activities so we can really be present for ourselves and acknowledgement of some of the conversations we need to have in our lives. So thank you for joining me in that. So here's another question for you. I want to get a sense of who's on the call with us. Where are you with your own advanced care plan? You can put the letter in there. These are kind of like prompt questions, but I want, so where are you with your own advanced care plan? A, what is an advanced healthcare plan? B, not sure where to start. C, have had conversations. D, I think I have one, but not sure where it is. E, it's on my to-do list. F, I'm in the process. G, it is completed, signed, and I have conversations with my family and healthcare team, and everyone has copies. H, my dog ate it. And I, you can add your own answer. Yeah. So Diane, you said you have an old one, or Gloria says, yeah, your dog ate it. Yeah, the idea of like where to get started and for a healthcare directive or plan, or an old one. Yeah, we're all in different places with it, but it's always important for us to check in about where we are with it. Yeah, on my to-do list. And I think sometimes, we feel like it needs to be perfect, and perfect gets in the way with just getting our wishes known. So hopefully this will kind of encourage you to kind of get some of the baby steps done, that and this is an ongoing process. So thank you for sharing that. So advanced care planning really is the conversations and directives for planning your current and future healthcare. It involves talking about your preferences, your values, beliefs, and preferences. And this helps make the decisions about what care what care you want or don't want at end of life. But that when you can't, especially this helps you make decisions about your care when you can't actually speak for yourself. I think that was cut off a little bit. Oops. So it's really important at many points in our life to kind of check in about how we feel about our current and future healthcare, right? So it's conversation and directives. And now we're going to go into some of the myth busters, some of the top 5 around your advanced care plan. So does anybody have any questions on this so far? Please feel free to put in the chat. I'm basically introducing different myth busters to kind of get you more familiar with advanced care directives. Okay, so the first one, Mythbuster 1, I have a will, so I don't need an advanced care directive. Well, congratulations on having a will, but yes, you do need an advanced care directive as well. So some of you might be familiar with going to a lawyer and saying, okay, I need a comprehensive estate plan. Like Sarah Polinsky, who was a lawyer that spoke earlier today, she might have addressed these 4 components that are usually taken care of as part of a comprehensive estate plan. The will, trust are more of the financial areas of things to deal with your finances and beneficiaries after you die. So it's important to have a will and trust in place to be very specific what your wants are for finances, to make sure you don't get into probate. So it's a really more financial side of things. The power of attorney for finances and the power of attorney for health are 2 documents that you're put in place. So if you are still alive but don't have capacity to make a healthcare or financial decision for yourself, these are the 2 documents that go into place when you're still living, but potentially not have the capacity to speak for yourself. Okay, so they're all important. But I'm more specifically involved in, because there are lawyers that go through all this, but maybe will spend more time on the top 2 and not give you the understanding and the conversation of the weight of the power of attorney for health, which includes a healthcare directive and living will. So when we talk about an advanced healthcare directive, which is number 4, it's a directive, and there's 2 main components of that. There's actually 5 that I have listed here, but the main 2 ones that we talk about are the power of attorney for healthcare, which is when you give permission for somebody to be your agent or surrogate if you're not able to speak for yourself. And then the living will, which is a component if knowing what treatments you want or don't want at end of life. There's also an optional area in that to add organ donation, physician designation, and signature and witnesses. This advanced healthcare directive only goes into effect if you're incapacitated and unable to speak for yourself. You can make it more durable for it to go into effect when you're living, if you really want, if to tell your healthcare professionals that, like, usually like in a hospice or more if you're terminally ill, then that person can speak on your behalf now, even if you have capacity to make that decision. There's other kind of directives and documents that we can discuss later on today. I just want to put it out there for you. In addition to an advanced care directive is a POLST, a physician order life sustaining treatment, and other addendums. There are now specific dementia directives that most people are interested in that get really specific, because if people have had the experience of taking care of a loved one with dementia, that they know that they now know what they do or don't want in case they can't speak for themselves. So there's more specific type of directives out there. This is the other directive I was telling you about. So there's advanced care directive, and then there's an additional directive called a POLST, which is something that you fill out with your healthcare team. This is usually done when, if you're in the last, let's say, the doctor feels you might die within a year, but that's usually if you have a prognosis of terminal illness. This is when you put this in effect. All right. The POLST also happens to be something good if you are a DNR, do not resuscitate, that you have this at home as well. So when EMTs come to, if you're hurt, if they come to your house, then you can have this on place, and then they'll follow the directions of the POLST, which is a physician order life sustaining treatment. Okay, we can always come back. This is just a highlight of different advanced care directives and documents that really are related to your health care. Okay, Mythbuster 2. I am healthy and youngish, so I don't need one. I don't need a directive. Well, that is false. If you're over 18, you should have a directive, because really we want to make sure that we honor how people want to live. And there's been studies out there that people want to be live at home with loved ones. They want their pain and discomfort managed, having their spiritual needs respected without being a devastation burden on loved ones. So having a directive in place, and in a lot of directives, there's different directives through different healthcare systems, or I have other resources where I'll share some other directives. But the idea is you want to let people know what you want or don't want. And so having a directive is one way to ensure that. All right. Some of the other statistics, most people, like even a lot of you on a call, said that this is on your to-do list and something that you know is important to have conversations about, but it doesn't necessarily happen. More than 80% of patients with chronic diseases say they want to avoid hospitalization and intensive care when they are dying, yet only 25% actually do. That's why having these directives to kind of let your team members, your healthcare team, your agents know what you want or don't want at end of life, and if you are not able to speak for yourself. Also, you know, this is not, advanced healthcare directives are not a one and done kind of thing. It changes over time and your own level. And so these are somebody mentioned that they have an old directive. So this kind of gives you a frame of reference for yourself of when you might want to consider updating your directives. Maybe every decade. You know, if there was a death in the family, let's say if somebody was your agent, you might need to update that or add your new agent. If there's a divorce, if there's a new diagnosis, and there's a decline in health. So, you know, decade is a large period of time, but if you have a diagnosis or decline, you might want to have these conversations sooner than later. Also, for those, Medicare now covers advanced care planning conversations. So it's really kind of encouraged, and know that there's a code that you can have these conversations with your doctor. So that is, there's a Medicare benefit code for that now. So I actually think at a certain point that if once you have your wellness checkups, if you do an annual wellness checkup, sitting down and talking about your advanced care directive with your doctor is a good kind of time to review and update if need be. You know, you update your insurances and your address and see if that's current. Well, what kind of care do you want or not want? A lot has changed in terms of what people understanding of their own health and what they want or not based on the COVID situation. So you might want to consider that. Mythbuster 3, my family knows what I want. Well, that's kind of leading. We know, well, here's another question that I'm going to show to you. Okay. So you think your family knows what you want. Here's another question for you. There's this new taboo game called the Death Deck. I know Lisa and Lori are the co-creators of this Death Deck card deck. And the reason why they created this is because Lori was a wife of a young man, her husband, who was in his early 40s, was terminally ill in a hospice, and Lisa was their hospice social worker. And even though they had very important conversations about what they want and don't want, there were some areas that were still not discussed. And so they created this death deck as a way for families to start conversations earlier rather than later. So I offer these death decks out and so on, as well as so I'm here to have you guys answer this question. Would there be difference in how your family would treat your medical condition if you couldn't speak for yourself? A, no, I've been very clear with my instructions. B, they would argue but ultimately agree. Or C, yes, they struggle with choosing a restaurant. Where do you guys fit into this? If this is a chat fill in right now, where does your C? Yes, they struggle choosing a restaurant, right? So the idea of planning for your own health care, everybody might feel really differently about it and might not agree with the care you want or don't want. So it takes the burden off of a family members if you're very concrete and share more with them. So anybody else want to share how your family fits in, of like knowing your wishes or not? B. Oh, Venice, hi. Good to see your name. It's been a while. Glad you're here. They would argue, but ultimately agree, right? So the idea of having something in writing in your own voice could save some of that turmoil, right? And having somebody chosen. Yeah. Yeah, B. Okay, yeah, they would argue, but ultimately, right. I mean, this is such a sensitive time in people's life. If you're, not able to speak for yourself, and there's others around, it's gonna be a challenging time for everybody. But having more in written or having these conversations in advance could be very helpful. Okay. My healthcare agent needs to be a family member. How do you guys feel about that? That is not necessarily true. The default is usually the next of kin, which is a spouse or domestic partner, and then goes to other family members. In some states, it's very like legalese of where they go through, but it's usually adult children, parents are top priority decision makers, making no mention of unmarried partners. But I was going to say, like, who do you call and why? Yes, someone you can depend on to follow your own wishes. Exactly. So I have a picture of like who do you normally would call if something happens to you. And there's various reasons you choose a family member, whatever reasons you choose people. Maybe it's based on geography. Maybe it's based on their knowledge of the healthcare system. Sometimes it's a reason of they're comfortable making and working under pressure. This is going to be a stressful time for them, speaking on your behalf. So you really want to take all these into consideration. And especially if you have a partner, that you definitely want that noted, because that can be a lot of not needed tension between partners and family members. So that's why you want to be really clear on who you trust, right? Who do you call and who are you going to trust? Yeah, and that's also, thanks, Denise, for sharing. I often worry about that myself, being a very small core family members. Yeah, there's also what's called fiduciaries. And these are individuals that when we showed you earlier, the power of attorney for for healthcare and finances, you can assign fiduciaries that, and there are many in Los Angeles that can speak on your behalf. There in California, there's actually a test. You have to be like licensed to be a fiduciary to speak on people's behalf if you aren't able to. So if let's say you want, if there's not a family member, if you're a solo ager, the idea of partnering and starting earlier in building a relationship with a fiduciary is also available. And then they can come into action if and when it's needed to speak on your behalf. It's a better way of doing it than waiting for conservatorship and having to go through the court system later on. So the idea of talking with friends, I know certain communities have each other. There's a group of friends that do it for each other, and because they've had these conversations and they know their lifestyle. Okay. Did I put this out of order? Okay. So also, I also wanted to acknowledge that who can sign or not sign for your, so one of the things that's important for your advanced healthcare directive, for it to be complete and documented, and this is sometimes what holds people up. They can get their directive, right? They fill out their agent, they mention what the treatments they want or don't want at end of life, but to make it legitimate, you do not need a lawyer, but you need either 2 witnesses or notary. So it's a process to even get this directive done. Your witnesses needs to be over 18. It can't be your healthcare agent or your provider. Can't work at the place where you live. So if you live in assisted living or skilled nursing facility, and one of your witnesses must not be related to you in any way. So they can't be benefit from your estate. So one of them can, one of them cannot be. Okay, so those are key things along with your advanced healthcare directive. And that was the 5th one. I think I forgot to put the Mythbusters, but yes, so you don't need a lawyer for your advanced healthcare directive. You need it signed by 2 witnesses or a notary. I think once again, when we package the power of attorney for health and finances together, sometimes the lawyers oversee all of that. There's really nobody responsible for you, to like say you have to have this done. But as you know, this is very important. So these are some questions you can kind of consider asking yourself to even get started. What do you need to think about or do before you feel ready to start planning or have the conversation? What is an important factor in choosing your decision maker? I'm curious for you guys right now. Let's pause on that question right now. What is an important factor for you, if you've been thoughtful about it, for choosing your healthcare agent based on what we've already shared before? Is it geography? Is it their values? Is it the trust? Is it nearby? Is it your partner? Knowledgeable about the healthcare field, right? Being able to navigate and advocate for somebody. What's another important factor for you in choosing a decision maker? If anybody else wants to share. Calm, yes. The idea of working under pressure is very important, yeah. Okay. Core values, trustworthy, reliable, right? That somebody's going to be able to know what's important to you, what values are important for you. Is it comfort over curative? Is it being in a certain environment, being at home? Is it getting all the information that's necessary. You know, it's all those type of things. Yeah. So here are some resources that I think are next steps in terms of making sure you're getting started on your advanced care directive. First, I like to know what healthcare system that you're all part of. When I say healthcare system, I mean, are you a member? Because I take it most people here are local in this San Fernando Valley. There could be others, but are you part of Kaiser or UCLA Health or Cedars-Sinai or Providence? Are you part of any, like if any of your primary care physicians connected to any healthcare system? Because I'm always curious how they engage you in your advanced care directive conversation. So the first time you don't hear about advanced care directives is if you're going in for a selective surgery and they say, oh, do you have an agent on file? And that's it. That's not very helpful. So I like to see what healthcare systems, all the ones that I mentioned, do have their own, and Cedars-Sinai, they all do have their own advanced care directives with those five areas: your agent, your living will, organ donation, physician designation for optional, like who's an important doctor in your life, and signature and witnesses. So yeah, Optum, I believe, might talk about advanced care planning. But there are some general resources here. And so this is what I'm sharing for you as well. And I'm also going to share with Niambi after this a PDF with review of the advanced care planning notes with all of you, and some other links as well. And hopefully she'll be sharing this, the PDF of this slide deck as well. And everything is what's called hyperlinked here. So everything you see here in orange, you can click on and get to. So there's a general California Advanced Healthcare Directive. Every state has a different directive. They have the same requirements. They're just, some are a little more detailed than others. Compassionate Choices, which is another organization that I used to work for. And they have a great guide on introducing conversations around end-of-life decisions. The Conversation Project is another great resource in starting the starting the dialogue of like what you need to know before you stop preparing. They have values checklists. They have fill in the blank answers so you can get more clarity on what you want more than what's in a simple directive. And there's some other resources here in terms of education and knowing where to start. I also wanted to just offer right now, I do these advanced care planning jumpstart calls. So they're 20-minute complimentary calls. So after this, if you want to kind of take it one step further, as you're all in different places regarding your advanced care directive and wanting to update it, to start it, get it out of your dog's mouth, I could work with you in terms of finding that directive and kind of holding you accountable at first to kind of move through it and make sure you feel comfortable and have more questions on that. Kaiser does a really good job of these conversations. And ideally, we want to make sure that it is easily located for you in your like health portal, your healthcare portal. All right. So, and then we really have some time now to really get into some more of the detailed questions that you might have. Yeah, I kind of rushed through that because usually I have more interaction with people, but I'm really curious to meet you where you are in the questions that you might have around your advanced care directive or need more clarity, because this was like a pretty broad overview.
So everyone, you can use your Q&A box at the bottom part of the page, or of course you can use the chat section like we've been doing today throughout the presentation, or you can just do the raise your hand function and we can hear your voice and you can ask us a question.